public health consultant in communicable disease control. What do you think the message is from the government, Dr. Barrett, that right now 38 million from Saturday will be in tier 3, but 4 days later you're free to mix and travel within the 3 bubbles?
Well, let me put it this way. If I was teaching this to my medical students at the University of Exeter, they would think Dr. Pankania is not with it. And unfortunately, we seem to have a lack of leadership to make the right decision, which is the virus doesn't recognize Christmas. We ought to be serious about it and say so, that 2020, Christmas, getting together, releasing restrictions for 5 days, not a good idea.
How much of a bad idea is it, though? How stark is it? I mean, is it as stark as the government effectively sending people to their deaths? Is it that bad?
Well, it is bad. And things that most people out there don't know about is as follows. If you honestly ask somebody in the National Health Service to tell you what is the waiting time for ambulances to get the patient into the hospital, just get the patient into the hospital, not see them, not manage them, get them in, they will tell you it is many hours. It is that bad. In other words, the hospitals are at full stretch. Ambulances are waiting outside to allow patients to be admitted. And the message I'm trying to get across is, yes, the hospitals, all of them are at full stretch, and we mustn't increase the load upon them. The further evidence that I'm very worried about, and I look at this every day in the area where I'm looking after, so east of England, Essex, that sort of area, the case numbers for the more vulnerable people, over 60-year-olds, has carried on showing an upward trend. And they are the people who end up being admitted to hospital, admitted to ITU, and become very, very ill. So all the indicators are there that we've got trouble ahead, and it would be better to sort of be bold and honest and say, let us not have a gathering over Christmas 2020. One more thing, if I may, please, because I was listening to the Northern Ireland report, and I think it is a really good idea to use the Christmas break and extend the shutdown from Christmas onwards for a few more weeks. And what that will do, hopefully, is bring down case numbers. So again, a brave decision required, like what I heard about Northern Ireland, which is extend the shutdown beyond Christmas.
So you'd like to see that follow in England as well? You'd like to see England, Wales, Scotland all follow suit, would you?
Indeed, because the case numbers are up, and we're kidding ourselves by saying we will get away with it. We won't. We know we've been here before. And then one more thing, if you were brave enough to say, let us take this really strong, robust measure like I've just heard Northern Ireland take, but at the same time, you carry on at full pace, immunizing as many people as you can. Now, what you do is you're building up a large population who are now immune. Better weather arrives February, March time, and we carry on immunizing. Hopefully by then, AstraZeneca Oxford vaccine will also have been released, and we gather momentum, and then we see the back of this pandemic. That would be my advice.
And just briefly, how long would you like England to lock down for on Boxing Day? 6 weeks, same as Northern Ireland?
I think 6 weeks is maybe a bit too long, but the criteria would be we wait for the case numbers to go down to tell us that we are now in command. So when you've got 400 per 100,000 cases, 500 per 100,000 cases, that's way too high. If you bring it down to manageable levels, like 100 per 100,000, you know you can start easing restrictions. And you also know by that time you will have deployed vaccines in a large way.
Thank you very much for your views this evening. Dr. Barrett Pankania, who's...
Thank you, Doctor. Really appreciate it. Cheers. That's wonderful. Thank you for waiting as well. Really appreciate it.
And communicable disease.